And welcome to the Dr. Bob Show. Have you ever taken over-the-counter Tylenol for a headache? Did you know that it could be dangerous? Have you ever taken over-the-counter Advil or ibuprofen for some joint discomfort? Do you know that that can be dangerous? Have you ever taken simple aspirin for pain relief? Do you know that that could be dangerous? We'll be spending most of this show talking about the dangers of over-the-counter pain medications. My guest is Dr. Michael Bernard. Dr. Bernard is a board-certified internal medicine specialist. He'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about a fluttering heart and an autoimmune disease more common than you think that could be making you feel very tired and listless. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Michael Bernard, and we're talking about the dangers of over-the-counter pain medications. Mike, welcome to the Dr. Bob Show.
Hey, glad to be here. Thanks.
Are there many pain medications over the counter?
There are.
Do they all have their problems?
They all have problems.
They all work?
They all work.
Yeah, and so I tell people there's no free lunch. And so every time you take a medicine, there's a potential side effect. Let's go into Tylenol. What's the generic name for a Tylenol?
Acetaminophen.
Acetaminophen, is it a common pain medication?
It's a common pain medication. It's used for all age groups.
And so you can take it in childhood, you can take it adult life. What are the problems with it?
Well, Tylenol, acetaminophen, is generally safe. It's been used for years, but like you were saying, there is no free lunch. Any medication has good effects and potential bad effects. And with Tylenol, the biggest effect we worry about is the liver.
So does it harm the liver, and everybody that takes it, does it have potential, or do you have to take too much? Where is the problem?
Yeah, the problem really is with overdosing on Tylenol. So chronic uses of moderate doses do not pose any problems unless you have some underlying liver disease, like alcohol-related liver disease or cirrhosis. But for the average person, a moderate dosage of Tylenol a day is safe.
So when you take Tylenol, there are a lot of different agents that have acetaminophen also in it, like Excedrin migraine, like any type of pain medication that you have. So how do you know if you're taking too much?
Well, and that's where a lot of the problems arise, is that people think they're taking a safe dose of acetaminophen, and then they take a cough syrup that has it in the ingredients, or maybe they take a combination antihistamine decongestant, and it's got acetaminophen in there. So you have to look at the ingredients.
And so you have to add up the numbers. Is there a certain amount of acetaminophen that seems to be the danger point? Or it depends on the person, their ability to metabolize underlying liver problems.
Well, the safe amount has decreased in the recent years, primarily because of those hidden ingredients that you find in some combination preparations. So now we say the safe amount generally is 3,250.
3,250. So that can be in divided doses. How long when you take acetaminophen, does it last 12 hours or 4 hours or?
Well, it depends on which dosage you take. So if you take the immediate release, we say 4 to 6 hours. The extended release, up to 12 hours.
So how do you know, do you see much problems, much liver failure in people with acetaminophen?
No, we don't. We see it in people who accidentally overdose, or in people who, unfortunately, sometimes intentionally overdose. But in the average person who's taking it as directed, we really don't see a whole lot of problems with it. You just have to be careful when you start combining medications.
And you mentioned alcohol in the use with acetaminophen. Danger point?
It's a danger point. Would not drink with acetaminophen, and liver failure is a very bad thing to have. And if you overdose on acetaminophen, and certainly alcohol is a component of that, it's can lead to liver failure. There are treatments, but it's an involved inpatient type setting. It's very intensive.
Can you tell if somebody's in liver failure?
So, well, due to Tylenol from chronic use, you really can't. You'd have to have laboratories monitored. But in somebody who has chronic liver failure, you'll have classic signs: swelling, malnutrition, muscle wasting,
Jaundice.
jaundice.
Yeah, so that's a difficult thing. If people take just a couple of days, they take too much, might they get liver failure if they just take a whole lot over 2 days? Not to intentionally overdose, but let's say they take, instead of 5 tablets a day, they take 10 tablets a day for 2 days.
So if you don't take an extraordinary amount, you're not going to go into liver failure due to Tylenol, but it's that, instead of taking 10 a day, you end up taking 20 a day.
There's no free lunch, and you're going to have
free lunch. That's right.
Potential problem. Children, you can have liquid acetaminophen. The problem would be if they happen to find a bottle and drink the whole bottle.
Yeah, you've got to put away these. They're very toxic in high doses. So for a child, if it tastes like grape or cherries and they drink the whole bottle, it can be catastrophic.
Yeah. So it's like everything else. You have to really be careful when you're looking at medications. And if you're combining one thing with another. Now, are there a lot of acetaminophen medicines over the counter?
There are. There's a lot of them. If you go to the local pharmacy, you will find them in all types of cold preparations, flu preparations, pain medications. It's very common.
And normally, does a doctor prescribe acetaminophen or Tylenol, or they tell the patient, listen, all you need for this pain would be some Tylenol, go over the counter and get it?
Well, we do prescribe it occasionally, but most of the time it's over the counter. We prescribe it in combination medications as well. So if we gave somebody a narcotic that happened to have acetaminophen in it, that's one of those cases where you might have an accidental overdose because the patient may be taking a pain medication written by a physician as well as the over-the-counter.
So you've got to read, the physician's got to be careful. You've got to tell your doctor every medicine you're taking. Are there other pain medicines over the counter that are common?
There are, and these medicines are generally safe. The biggest class would be non-steroidal anti-inflammatories.
We call those NSAIDs, so N-S-A-I-D, non-steroidal.
That's right.
Anti-inflammatory drugs. What would be some examples of those?
So the biggest ones would be ibuprofen or naproxen.
So ibuprofen, naproxen, Advil, Motrin, all of those can be potentially dangerous?
And they can be, and we really have to watch this.
And that's what we're going to be talking about when we come back. We've really got to watch those. The ibuprofen type medications also can cause problems other than liver problems like Tylenol can. You'll want to stay tuned. We'll talk about ibuprofen, and then we'll talk about other NSAIDs. We're talking with Dr. Michael Bernard, and we're talking about over-the-counter pain medications and the dangers. We've talked about Tylenol, acetaminophen. Remember, you can find different types of medicines over the counter that all have acetaminophen, and when you add it up, too much acetaminophen, especially if you're using alcohol at the same time, can cause liver failure, and liver failure can cause death. Now, we're talking about NSAIDs, non-steroidal anti-inflammatory drugs. What are some of those medications?
Well, Advil and Aleve are the name brands.
And Advil's ibuprofen, can it be dangerous? I thought it's pretty simple.
Well, for the most part, they are very safe, but especially in certain patient populations, we have risk of gastrointestinal effects as well as cardiovascular events.
So ibuprofen can cause problems with the stomach?
It can.
What does it cause?
Well, it can cause gastric ulcerations, so that's a big concern.
It's a big concern. Common cause of GI bleeding. So if people take ibuprofen or they take Advil, they take those mainly for joint pains. like bad knees, bad feet, bad hips. You take it long term, therefore, because the pain doesn't go away.
Yeah, that's right. And we know that with these non-steroidal anti-inflammatories, these NSAIDs, the longer you take the medication and the higher dose you take, the higher your risk of having an ulceration in your stomach would be.
What would the symptoms be of ulceration in the stomach?
Hunger pains, nausea. You have an early sense of just getting full.
And that's a sign. So if you do have some GI bleeding, that changes the stool color, certain color.
Yes, it can make your stool black.
Yeah, it's melon. So if you get black stools and you're not taking iron, you need to really see your doctor quick, especially if you're taking ibuprofen. Now, can ibuprofen cause high blood pressure?
It can, and we think that it causes it because of fluid retention. If you're taking ibuprofen on a regular basis, or really any NSAID, you should be on a low-salt diet, trying to reduce that fluid load.
I was talking to a cardiologist once, and he said, if I see people in my office that have got hypertension, the first thing I ask them is, how much ibuprofen are you taking? So it can cause kidney problems, causing high blood pressure, and it can cause stomach problems, causing GI problems. Does it bother the heart?
It can bother the heart, and especially in certain patient populations. So we know that if somebody has established heart disease, that non-steroidals are probably not the best choice for them. If they're an older age and they have risk factors for heart disease, if they smoke, and we hope they don't, but if they have high blood pressure and high cholesterol, maybe there's a better choice.
There were some medicines that they took off the market, Vioxx and Bextra. Those were non-steroidal anti-inflammatories associated with heart disease. But now we know ibuprofen and other medicines also. Aleve and naproxen, the cardiologist told me, has less cardiovascular events. How do they do as far as the stomach goes?
Well, that's right. So Aleve, we feel like has less cardiovascular events, and if we have heart disease and we have to take an NSAID, that's probably the one we want to take. But we also know that it causes a fair amount of gastric ulceration. Perhaps if you have to take that on a regular basis, especially at a higher dose, you should also be on a medication to protect your stomach as well.
So what medication will protect your stomach if you're taking Aleve or naproxen?
So you could take Nexium or Prilosec over the counter. Those would be the most common ones.
Sort of a proton pump inhibitor, cuts down the acid of the stomach, protects it from the ibuprofen assault on the stomach that we have there. So we're saying there's no free lunch. We're saying Tylenol, acetaminophen, if you take too much, it can cause liver damage. Ibuprofen can cause stomach problems, GI bleeding, as a matter of fact, and also hypertension. How about simple aspirin? Can aspirin be dangerous?
Well, aspirin can be dangerous. And when I was in medical school, they said if aspirin came out as a new drug, it would never be approved.
Oh.
But
Why would
it has a lot of potential side effects. And we know that in small doses, aspirin can be very beneficial in preventing heart attacks and strokes. But in large doses, it can cause a lot of ulcers. 1 out of every 3 people could have an ulcer if they take high doses. So it's got a fair amount of risk.
You know, when I used to play a lot of sports, I would sometimes take too much aspirin. I'd take 5 aspirins and go out and play. It had potential danger, didn't it?
That's right, especially because the effects of aspirin on the stomach are long-lasting. Those effects can last in the stomach for up to a week, as opposed to Aleve or Advil, which those effects are temporary. You take it and then the effect goes away after a day.
Now we call these non-steroidal. It means no steroid anti-inflammatory. Can steroids help joint pains?
Well, steroids make people feel great most of the time.
They take all the pains away, don't they?
That's right.
But they have the steroids would be like prednisone, methylprednisolone, those medications. What kind of side effects do those cause?
Well, those medications, like you said, make the aches and pains go away. But the side effects are so much that we usually use those in very unusual, severe cases because of your incidence of gastric ulceration. It can cause diabetes, blood pressure becomes elevated, your adrenal glands shrink, you can get osteonecrosis of your joints, you can get osteoporosis. The list goes on and on.
Yeah. Posterior subcapsular cataracts, moon faces, acneiform rash, holds on to fluid. You know, it really is a wonderful medication, but if you use high doses long term, do some people have to use it long term?
And some people do. I mean, if you have rheumatoid arthritis or some type of inflammatory arthritis, you have to. But we monitor the side effects closely, and it's really something that if there were a better choice, we would use a better choice.
So if I came to you and I was having just headaches, non-pounding, non-migraine, just non-specific headaches, tension headaches, which medicine would you use?
Well, that's a great question. So I would personally use a leaf, but I wouldn't use it on a regular basis because, like you said, any medication has a downside to it. And if you had daily ingestion of one of these NSAIDs, it can actually cause the headaches to continue. So I would use a leaf today, but maybe tomorrow I would use Tylenol.
If I was a runner and my knees were hurting and they got stiff in the morning and my feet were all stiff, which one of those would you use?
Yeah, well, I think generally most people should start off with Tylenol because it's the safest choice. But if that doesn't work, then try one of the anti-inflammatories. As long as you're not taking it on a regular basis, you should be okay.
What if your joints are hurting on a regular basis and you take ibuprofen type medication for a long period of time? The dangers you've already talked about, so you have to work that out with your doctor.
Absolutely.
Kidney function test and looking at the GI symptoms. So it gets pretty complicated. It's not just taking simple over-the-counter medications. Are there other over-the-counter medications for the stomach, for the allergies, for sinuses that we see when we go into the drugstore?
There are a lot.
And they don't have any free lunch, do they?
There's no such thing.
Mike Bernard, thank you for coming in and teaching us about the potential dangers. All these are good medicines. They're safe medications. But like everything else, if you abuse them, then you could cause potential harm. Been a great teacher. Thanks for coming to the Dr. Bob Show.
Thanks for having me.
And now you're going to want to stay tuned. We're going to be talking about that fluttering heart, what causes it, and an autoimmune illness, very common, much more common than you'd think. It makes you just feel tired and a hoarse voice. See if you can guess what it is before we talk about it. I want to thank Dr. Michael Bernard. Wonderful discussion on dangers of over-the-counter pain medications. Now, for information from you, the viewer, that I think will be important to your health. Dr. Bob, first question is, Dr. Bob, my heart races and flutters. What should I do? Very, very common problem. A lot of people have extra heartbeats. They're called premature beats. They can come from the main pump or the receiving chambers. And it's a little bitty jolt that some people feel. It's benign, it's no problem, unless with exercise, you find that you start getting more of those extra beats. So let's talk about the heart for a minute. Let's talk about the heart rate, and let's talk about the heart rhythm. The heart's an amazing organ. It beats normally 60 to 100 times a minute. If it goes less than 60 times a minute, we call it bradycardia. There's some medicines, some beta blockers that can make the heart rate below 60. Athletes, Olympic athletes that are in shape, sometimes they wake up in the morning and their pulse is 46. Over 100, we call that tachycardia. There's lots of illnesses that can cause tachycardia. Anemia, the heart has to work harder to get blood around if the blood count is low. Overactive thyroid can cause problems. Congestive heart failure can cause the heart rate to be fast. So there's lots of things that can cause tachycardia, and there are rhythm problems that can cause tachycardia. What are some of those rhythm problems? Well, one is atrial fibrillation. There are two types of atrial fibrillation. Number one, that's paroxysmal. It seems to come and go. It will usually start in somebody's 40s. They can feel a little flutter, and usually it's very infrequent. Then it becomes more frequent, and we get runs of fluttering. Maybe it may last an hour. The heart rate may go up to 135 or 140 or even 160, and the person gets short of breath, and they can feel their heart pound, and then bingo, it goes away. People learn that a Valsalva, straining down or coughing hard, sometimes will make that atrial fibrillation go away. If it becomes chronic, here's the problem. The atrium, which receives the blood, flutters, and it flutters at a rate of 300 times a minute. And 300 times a minute, that means the blood is really not moving in there, and so it can become stagnant and a clot can form in the atrium. If that rhythm is changed to normal, when it changes to normal, that clot can go from the left atrium to the left ventricle, the big pump, and then it's thrown out into the body. The easiest way for it to go is up to the brain. Some 15 to 25% of strokes are due to blood clots that occur from the heart in people that have atrial fibrillation. So the treatment of atrial fibrillation can be with medications to slow down the rate, or medications to get the atrium keep from fluttering. An electrical shock can do that. Or there is ablation, and that's where we do a heart cath, and we find the area. They do it by what they call mapping, and they can map the excitable places of the heart. And then with a catheter, they can go up and they can burn those areas with laser treatment. And sometimes, 85% of the time, the atrial fibrillation will go away and will stay away. Sometimes it takes 2 ablations to do that. There are medicines to use to help the heart at that time, and if somebody has chronic atrial fibrillation, they almost always have to be on a blood thinner so that that clot won't occur in the heart, so it won't go to the brain, so we won't have a stroke. So if you have fluttering of your heart, know that it's a simple flutter. Occasionally, it's probably no problem. But regular flutters, you have to see your doctor. He has to figure out what is the cause and get you appropriate medication. Question number 2. Dr. Bob, are there autoimmune diseases that make people feel poorly? That's a very sophisticated question. What is an autoimmune illness? Well, that's where the body looks at itself and the immune system begins to attack itself. There are several conditions where that occurs. Lupus is an autoimmune illness. There are some kidney diseases that are autoimmune. But the illness that I wanted to talk about that makes people feel so poorly is an autoimmune illness against the thyroid. The thyroid sits in the neck. It puts out a hormone that's responsible for our energy, for the metabolism of cells, for how fast our heart goes, and it really makes us feel good. However, if autoimmune illness begins to attack the thyroid, then it recruits cells we call lymphocytes. Those lymphocytes will replace the thyroid gland, and it does it very slowly. Not like over days, not like over weeks, but maybe over months. So over months, a period of time, the thyroid becomes less and less active because these lymphocytes take over. It's called Hashimoto's disease. It's an autoimmune thyroid disease. It causes hypothyroidism. And the symptoms of hypothyroidism are, I don't feel good, I'm tired all the time, my skin is dry, you lose the lateral third of your eyebrow, the voice becomes hoarse and sluggish. Sometimes the GI tract becomes more constipated, more problems with that. There are trouble that people have with menses. It's more common in women than men, but I think the key to autoimmune thyroid disease is that it occurs over such a slow period of time. So slowly you become fatigued and you just don't feel good, and you don't recognize the changes from a year ago to today on how poorly you feel. Usually in a routine examination, your doctor will feel your thyroid. He'll get blood tests looking for, if you complain of fatigue, looking for abnormal problems in your blood count, but he'll also check your thyroid. He'll find that the thyroid is low, and then looking into that, he can find autoimmune thyroid disease called Hashimoto's disease. The treatment can be surgery if that gland gets too big. It's a very sticky gland that holds on to objects that are around it. So the doctor, when he takes out the thyroid, has to be sure that he doesn't remove a parathyroid gland or the recurrent laryngeal nerve that sits right behind the thyroid and is responsible for our vocal cords to work. So if by chance that nerve is cut, then the person has hoarseness for a long period of time. So it's like all illnesses. You need to see a doctor that's experienced in your illness. If you need surgery, you need to have somebody that's experienced in thyroid surgery. That's all the time that we have for this show. Remember, you've got to be exercising 30 minutes, 5, 6, 7 days a week. You can just be walking, brisk exercise, more pain, more gain. Be sure we're eating properly, less food, better food. Stay away from fried, fatty, greasy foods. Be sure you're getting 7.5 hours of sleep. If you're not sleeping well, be sure that it's not due to medications. Be sure that it's not due to the times of day you're sleeping. And most of all, what is it we like in the Dr. Bob Show? Well, it's laughter in your life. The literature says that when people laugh a lot and they're happier, their immune system works better and they don't get infections as much and they don't get recurrent illnesses. So be sure that laughter is part of your life. Find that friend that you sit down and tell funny stories, laugh and giggle. There's nothing I like better than to hear my wife giggle telling funny stories, and she is healthy.